When you go to the loo, are you able to, like, hold in a fart? Oh, that's a funny question, I know.
That's a very, very strong painkiller. How much do you take?
But I max out the daily amount.
This stroke sounds very dramatic and it's changed your life, I imagine.
Dirty.
3.5 months ago, they found a cancerous lump.
What a shock for you.
It was awful. My interest in medicine developed probably for all the wrong reasons. I really loved a programme when I was younger called ER, and I had a huge crush on George Clooney. And I realised actually after a while I was watching it not just to look at George Clooney, but because I was really enjoying the medicine. In my heart, I love knowing a little bit about everything rather than being super specialist in just one area. And I love the whole thing of seeing your patients on a regular basis and getting to be part of their lives.
How are you feeling today, then?
I feel terrible.
Yeah.
Right, come on in.
Hi.
Hello there.
Come and have a seat. Oh, you okay?
Bit giddy.
Bit giddy. Okay, let's get you down.
Thanks.
Okay?
Good.
Is that why you're here?
Yeah,
Yes, okay.
it is.
So tell me a little bit about what's been happening.
So I woke up this morning, felt
Yeah.
fine, got into work, started my daily routine there, and was struggling with the computer and the phone and kind of switching between the two. I started to feel giddy, and then the sickness kicked in, and it's just got worse over the last couple of hours.
Has anything ever happened like this before?
Yeah, I had something like this once before, and it was an inner ear infection.
Yeah. Does it feel like that episode you had in the past?
Yes, it does seem like that.
Okay. How about your eyesight?
My eyesight is okay, I think.
There's just
although
one of
I'm-
me?
Yeah,
Yes,
there
good.
is.
Okay, that's
yeah.
good. Okay.
Yeah, I woke up actually thinking everything was fine, and it's just come on so quickly, really.
Yeah, it has. I was having a little look at your notes before you come in. You don't tend to come to the doctor very often. Is that right?
Yeah, I'm
Yeah.
a really healthy
Yeah,
person.
you're good. And not on any medication or anything else
No,
like that normally?
no.
Fine. How did you get here today?
My husband brought me
No, that's the right thing.
do the
Good.
stairs,
Yeah.
so no.
Let's do a few things then and just see what's going on. I'll just do your blood pressure thing. I'll try not to move you as much as possible. Bear with me 2 ticks.
Hello, Piotr.
You right?
Is that right? Is that how I
Yeah.
say your name?
Yeah.
Polish name, is that right?
Yes.
Very good.
Thank
Come
you very
in.
much.
I'm Dr. Taylor. Nice to
You
meet
all right?
you. How can I help today?
I feel the pain in...
In your testicle?
Yes.
Yes, I saw that on the notes. How long for?
Couple months.
A couple of months.
Yeah.
Is it in the testicle itself or is it in your
is
groin?
In the testicle
In
itself.
the testicle
Yeah.
itself. So it's worsening.
Yes.
Any worse when you pee?
No.
Any problems having sex?
No.
No. Okay. And no sign of redness?
No.
or- And does it ease at all? Has it been getting progressively worse? in the
No,
past
no.
2 months?
It's comes in and comes out. So like I ran yesterday refereeing. So I was on the line, so it's a lot of sprints, and then I
Yeah.
could feel the pain. Sometimes when I sit down, sometimes when I stand up.
And are you in a sexual relationship at the moment?
Yes.
Yes. Have you had a sexual health check ever? Sexually transmitted diseases can sometimes cause pain in testicles.
No, I have the same partner for last 7 years.
Sure, sure. And the only reason I ask is because sometimes you can get a sexually transmitted infection that, particularly in men, can be very asymptomatic for many years, or in women can be asymptomatic. So it might be worth us sending you at some point just to have a full check, just to
Okay.
make sure that there's nothing going on with that. All right, shall we have a look? Is that all right? So I'll just get this curtain back. But you've not felt any lump in the testicle?
I don't know, hard to say.
Yeah.
I'm not a doctor.
No, sure, that's my job, indeed. So if you just pull your bottom things
Yeah.
down. Fine.
All the way down?
Yep, if that's all right. Now show me where you're feeling the discomfort.
Yeah, it's...
On this side.
Yeah, it's right
Okay,
side.
sorry to feel. Okay. Is that painful when I press?
No, it's more on the right side.
No lumps that worry me. Lean back for me, put your legs up if that's okay. I'm just going to feel your groin as well. Any pain when I press in the groin there? No. All right, all done. I mean, the good thing is I can't feel any lumps. There's nothing obvious to see or feel, which it's very reassuring. It does still mean that we're not 100% sure what is going on. I do wonder if it might be a little bit of groin strain that is leading down and you're feeling the pain in the testicle. But the honest answer is I'm not sure. I think it is more likely muscular than anything else. There's something called epididymitis, so an inflammation of the top part of your testicle, which can sometimes be caused by sexually transmitted infection. We need to get the sexual health check, just to double check we're not missing anything. Keep feeling the testicle. If it gets worse or it swells or anything changes, you get back in touch and we'll go from there. The other thing I would like you to do, if it's all right, is just do a urine sample for me. Let me give you a pot. If you can just do that for me and then just let reception know it's there and I'll come and pick it up and send it all off to the lab just to double check.
Okay.
Go back straight through to the main building again. And
all right. Thank you very much.
Nice to meet you.
Care.
Take care.
Bye-bye.
Bye-bye.
I want you to keep your head nice and still for me and just with your eyes follow my finger. Yes. Is that making you dizzy?
Yeah.
Yeah, sorry, I can see it in your eyes when you do that. Look up.
Oh.
No, it's okay.
That's all right.
Fine. We've got the diagnosis. So it's labyrinthitis. It's this inner ear infection. It sounds very similar to what you've had before. What happens is your inner ear does your hearing, but it also does your balance.
Right.
And sometimes if it becomes a little bit inflamed with a little virus or something like that, the messages that it's giving your brain doesn't quite match with what your eyes are telling your brain. So your brain is getting messages saying your eyes are looking forwards, but your ears are like, actually, we think you're looking that way. And so every time you move, your brain is trying to decide, where am I? Which is what gives you that horrible spinny feeling. The infection itself, your body will just fight off just like any other cough or cold, but the medication will make you feel better whilst your body's fighting the infection and make you feel more human like you did first thing this morning rather than how you feel now.
Good.
So I will get the prescription sent through for you. Keep using that for the next few days. The computer screen is probably the worst thing for it because it kind of flashes anyway. So I think realistically no work for a little bit until you feel
I'm going to go home and do nothing.
nothing. Perfect.
Because I don't think I can. And you've told me.
Doctor's orders. Yeah, exactly. Feet up today.
Thank you so much.
Is your husband just outside?
He was, yes, so...
I'll come and help you out.
Oh, thank you.
Oh.
Thanks so much.
No problem.
Thank you.
Do you need help working out?
Oh, no, my husband's there, bless him.
Oh.
So I'm sure he'll come to my aid.
All right.
Thanks.
Bye-bye.
How are you doing?
Not too bad, considering.
Yeah, tell me what's been going on.
Well, it was a bit of a shock. I went for a standard blood test because of like high blood pressure and cholesterol.
Yeah.
And then I had a call from the hospital. They said that it was it's blood cancer and bone marrow cancer. It's been a total shock to me and my family.
Yeah.
Shock. I still can't believe it sometimes.
It's a really big diagnosis. Tell me how it's impacted you, what it's
I'm just
affected.
scared.
Yeah. Oh, my love.
My husband died of cancer 3 years ago.
Oh, I'm sorry.
He suffered terribly, and I see that's going to happen to me.
What kind of cancer did he have?
Bladder.
Okay. And is that your worry that you might experience something similar?
I'm not good with pain.
No. Okay.
I wouldn't like my family to see me the way he was, you know, It was dreadful.
It's difficult when you've had one experience with cancer, when it's someone so close to you, and then you get a diagnosis, and even though it's a completely different illness, the word cancer is in there.
Scary word.
Very scary word. But you will not have the same experience. It's a very different illness, and they behave in very different ways. I completely understand why you would have that worry, I really do. And was there something you were hoping I might be able to help you with today?
Well, what's been happening lately is at the site where I had the bone marrow done, it started to ache.
Okay.
Sometimes ache quite badly.
Yeah.
Sometimes it makes me limp a little bit because it seems to go down the leg.
Yeah.
And I'm wondering, is that normal?
Do you mind if I just have a look at it? We'll have a look on the couch.
No.
Would you mind just lying on your back? I'm just going to bend your knee now and then push it right back there. Does that cause any discomfort at all?
Yeah, it's a bit.
Just along there. And then I'm going to do the same here.
No.
Not cause any problems there. Okay, lovely. You can come off there now. Come and take a seat. So, pain at the bone marrow biopsy site after they've done the procedure isn't unusual. It's a big piece of bone that they take away. I'm not worried about the bone or the bone marrow
That's
there.
good.
I suspect this is a coincidence that you've got the pain in that area, and I think it's muscular pain that you're getting and it's pressing on a nerve. I don't think it's related to there. And keeping active is the best way to try and manage this, and some ibuprofen gel might be a good idea.
I've got some.
Perfect. You said you want to carry on life as normal. Is the worry of this stopping you from doing the things you would normally enjoy doing?
I can't think about planning too much in advance, just in case.
Yeah.
I am going to be going away for a week in September. Do you think that's all right?
I think that's a really good idea. Not only is it good for you physically, but mentally it will take your mind off the stress of this. Anyone would be worried about it, but don't let it consume you, because it can do that.
Yeah, that's when you start getting thoughts in the middle of the night, when you're led there in the dark and, you know.
Anything else I can help with today?
No, I don't think so.
Well,
Unless
thank
you
you
can find a cure.
I wish I could. Listen, at this stage, just try and do as many of the things that you enjoy doing as possible, because the more your mind wanders, the worse it'll feel to you. All right, my love.
Yeah. Thank you very much.
Thanks, Mrs. Milton.
Thank
Lovely
you.
to see you.
And
Let me
you.
get the door for you.
Thank
Cheers.
you.
Bye-bye.
Thanks so much for coming in.
Thank you.
See you soon. Thank you.
Bye.
I was at training.
Football, by any chance? Yeah.
Are you good at football? His hands are good at football.
Play badminton a lot. I cycle 200 plus miles a week.
Wow.
Tell me about the ultramarathon.
This one's an 85-kilometre one over the mountains.
You don't cross the line feeling sick. You haven't tried hard enough, apparently.
This is where you get a tennis elbow.
I would have thought, because I never played tennis.
Good luck with the cycling tonight.
That's great.
Put me
Thank
to
you.
shame. We're going for pizza.
How are you today?
All right, not bad. Yeah.
You been up to much? Or?
I work down at the football club, so we've had all the kids.
Was that for Swindon Town?
Yes, I played there and obviously got the opportunity to come back, and I love the club, so...
Yeah.
You played for Swindon?
Yeah.
Did you?
Yeah, back in the day.
Will you play other places as well?
Yeah, I started at Carlisle, then went to Mansfield, Man City, Bristol City, Sheffield Wednesday, Swindon, Grimsby, and then I kind of fell into coaching. Just absolutely love it again.
Hi, is it Lee Peacock?
Yeah.
Would you like to come in, Lee?
Yeah, Lourdes. Cheers. See you later.
See you later.
Bye.
Take a seat there.
How are you doing? You all right?
Fine, thank you. Are you?
Yeah, not
Well,
bad.
you're here, aren't you? So you're not spot on. What can I do for you?
Basically, I've had a problem with my knee the last 4 months. I've had ligament damage, cartilage operations. They normally clear up, but this pain is not going anywhere.
Right.
It's kind of really affecting what I do on a day-to-day basis.
And what painkillers do you take?
For my back, a couple of operations on my back, I've been on tramadol.
That's a very, very strong painkiller. You understand about that, don't you?
Yeah, I
And
suppose.
painkillers like tramadol are a strong opiate painkiller. Recently, there's been lots of research to show that people who are taking these painkillers for chronic pain don't really get benefit from them. They develop tolerance fairly quickly, really. Patients then need higher doses and higher doses, and when they try to stop them, they can't do it. It's important that you know that.
Yes.
Start thinking about other alternatives and a careful planned reduction of the tramadol. Would you like that?
Yeah, I actually would, because I've tried before without a real plan, and it's through personal things that have happened. You get a little bit of pain and it's easy to go back on them.
It's really important that patients are supported slowly and gradually to come off these medications. Most patients will come back to you and say, I feel fantastic.
It's been 10 years, so...
Right, so that is a long, long time. And the things that it can cause are things like if you don't get your tramadol, it can affect your mood, it can affect your functioning, your thinking, your nerves. So it's something to think about. How much do you take?
I max out the daily amount.
Believe it or not, if you take 8 paracetamol a day and you're taking tramadol, you will get really good improved pain control.
Okay.
But I'll have a quick look at your knee and then we'll take it from there.
Thank you.
How can I help? For a few years, I've had lower back pain, and I'm a nanny, so I put it down to carrying children on my hip.
Sure.
But recently it's got really excruciating, like quite debilitating. I've just been away on like a 3-week holiday, my honeymoon.
Oh,
And
congratulations!
Thank you.
Where did you go?
Hawaii, California and Vegas.
Oh my goodness.
Yes, it's a big
trip.
trip. So there's a lot of flying, so I really found it excruciating to just sit still and it's like pulling like almost into my bum.
Okay.
Since then, I've had like tingling up my leg, like pins and needles, like numbness. And then this morning I had like pain behind my calf. I'm also pregnant.
Congratulations.
And thank you. And then I just saw something about DVT and pregnancy and I was like, oh my God, I need to see a doctor.
So tell me a bit more about this back pain. So it's been for years on and off?
It's been about 3 years,
Okay.
but it's been like bearable pain. It's been like lower
so this
back pain.
new excruciating
This
pain
is like really pulling, like spasms. I can't sit in a car.
Is one side worse than the other?
It's only on one side.
It's only on one side,
Yeah.
and it's on this left side?
Yeah.
Okay. And you're feeling this tingling in your leg now?
Yeah.
Okay. Have you heard of sciatica?
Yeah.
Yeah. So from what you're describing, I think that's probably more likely than anything
Yeah.
DVT to worry about. However, we'll have a look at your calves as well. When did you find out you were pregnant?
Yesterday.
Yes, oh my goodness, it's all happened. Bless you. Was that planned? No. Okay.
I'm married,
are
so.
you happy?
Yeah.
It's a bit of a
Yeah.
shock, goodness me.
Yeah.
Literal honeymoon
Yeah,
baby.
yeah.
Okay, goodness. Okay, so lots going on for you. And would you say the DVT thing, is that just been playing in the back of your mind since the
Yeah, I'm
calf
just a bit
pain?
paranoid.
Of course,
Yeah.
of course. Right, let's measure your calves first while you're
Okay,
sitting.
Okay.
Because one of the things we want to see is there any swelling on one side kind of compared to the other. Obviously the flying does make you a bit more at risk of that.
So I had my legs waxed this morning, so they're a bit oily.
No, they're nice and smooth though.
They were horrendous.
They're fine.
Okay.
Okay, so there's no great discrepancy there, which is
Okay.
great. Let's get you on the bed and just have a feel. So what we can do in order to rule out a DVT, to put your mind at rest, is do a D-dimer, and if it's
Sit down?
normal, yes,
Yeah.
it's a blood test. If it's normal, it's very reassuring. If it's high, it doesn't necessarily mean anything.
Okay.
So we can certainly do it, and hopefully it'll be able to reassure you. If you can lie down, if you can bear to.
You tell me if anything hurts.
They're down there on the inside, obviously.
When I'm touching, it's the inside of that
yeah.
knee. Okay. So I'll tell you what I'm looking. So
Yeah.
it's not
See that there? That's sort
When
of
you-
just when it's straight.
when you extend your knee like this. That's where people often get quite a bit of pain.
Yeah, that's.
Let your leg go loose. I know it's hard, and I'm going to push it. Does that hurt?
Yeah.
And then I'm going to push it the other way.
No.
No.
nothing on
So
that
it's
side.
when I bend it inwards
Yeah,
like that.
yeah.
That hurts.
It's not the pain I get, but there's a twinge there.
There's a twinge. It does need referral to a specialist MSK clinic because your knees have been knocked all your life. So it's not like examining a knee from somebody who's not done much.
Yeah.
And it's stable.
Yeah.
You can come back down.
Okay, thank you.
So
Too quick.
I will have a look at the pathway for referral to musculoskeletal services.
That'd be
Is
amazing.
that okay?
Yeah, no, perfect, thank you.
I'm not sure what the waiting time is or anything, but I'll definitely put the referral in tomorrow morning.
Okay.
Is that okay? Is
Yeah,
there
no.
anything else I can do for you?
No, that's
You're happy
perfect.
with everything?
Yeah, brilliant.
It's
Thanks.
lovely to meet you.
Okay, take care.
All the
Thanks
best.
for your time.
Thank you very
Appreciate that.
much. Thank you.
Thanks, mate.
That's numb down there.
It's numb. So it doesn't feel different when I touch you.
No.
When you go to the loo, are you able to like hold in a fart and you still squeeze your buttocks together? And that's a funny question, I know. You can still get that squeeze.
Yeah.
No problems with holding your wee in?
No.
No incontinence at all?
No.
Sometimes with sciatica, so what sciatica is the sort of the impingement of the nerve, and often when the disc prolapses slightly, so it comes out, the jelly bit pushes against it and it can irritate, and what we often get is buttock pain, low back pain, buttock pain
feel
down
like it's
into the
nerve.
legs,
Yeah, definitely.
and it can cause some numbness and tingling. Most commonly we can manage it really conservatively with some good physiotherapy.
Okay.
And if it's very serious and it's causing problems like incontinence or numbness around your bottom, then we would need to think about speaking to neurosurgeons and things, but you're nowhere near that.
Okay.
Do you do any exercise other than rushing around after children?
I was going to the gym and having personal training sessions before the wedding, but I've stopped that now.
Come and have a seat. Pop your shoes on and come and have a seat. We'll have a chat. You know, unfortunately, often when you're tall, you're doing a very manual job, lifting heavy loads, which is children, you are going to be more prone to potentially having back problems. So I think most likely it's sciatica, and what I'm going to do is I'll get my colleague to ping you over the link to the leaflet on Satica. But what I am going to do is organise for this D-dimer blood test just to reassure ourselves because of the flying. But we will also book you into physiotherapy.
Perfect.
I think probably you've aggravated it with all the sitting. And then did you do quite long drives when you were touring as well?
Yeah.
So there's been a lot of sitting,
Yeah.
a lot of long drives. Wonderful. All right. So any worsening symptoms, anything that changes in terms of those things we talked about with the sciatica, i.e. the bottom, the numbness, any problems peeing or pooing, just get in touch.
Okay, amazing. Yeah,
all right.
thank you
and we'll
so
get in touch
much.
about the physio.
Yeah,
okay.
Thank you.
No problem at all. If you go back over to reception, I'll sort out this blood test. Okay,
Thank you.
well. All right. Take care then. Bye.
See ya. What brings you here today? Hi.
Well, I went to my doctor's on Monday because I'm type 1 diabetic, so I had my bloods done and feet checked. She was concerned about my feet because she made me close my eyes and felt some in my heel, but I couldn't feel it. So she more or less told me to go home and Google a chiropodist.
Okay.
But last night I was in so much pain with the sole of my foot, I ended up in A&E for 7 hours just to be told to phone my doctor again this morning.
Blimey. All right, I'm sorry about that.
I'm in so much pain. It's not even...
Yeah, but they also thought there might be like gangrene.
They said
on
being
their heel.
diabetic, the hard skin underneath it looks like it might be gangrene, but I don't think it is.
Well, if they thought you had a gangrenous foot, they wouldn't
they
normally
just
send you
me
just
home.
send home and book an appointment with a GP.
Yeah.
That's quite a serious issue.
But when
that
I
would
went
need...
to A&E last night, 2 doctors said to me they should have put a referral in when I went to my doctor's on Monday, but nothing.
I noticed a couple of missed appointments with that.
So bad, 2 appointments I've missed now, and like the next one I get, I'm not missing it because I know my eyesight's getting worse because I have to, when I'm reading, even with my glasses on, I've got it right up to my eyes now.
Look, it's a difficult time for everyone with work and what have you, and we all need our jobs and income, and everything is so
Definitely
precious.
now, yeah.
But you've got to take a long-term view on that,
Yeah.
because if you're missing interventions that the specialist can offer you, there's nothing more important
than my eyes,
than your feet,
Feet and
your
my
eyes,
eyes,
your kidneys, everything.
So the wife's been hassling me about my moles on my back.
Right.
So I've always been quite a moldy person.
It's sort of like a little lump I have in my side.
Okay. Is the lump painful at all?
It's been painful for probably 5 years now.
Oh, I got a lump deep down in there, so that's the one that keeps me up at night.
Well, you have got a lot of moles, haven't you?
Yeah.
You'll have to point it out to me. Is it that there yet?
Yeah, you can almost sort of see it, can't you?
Well, I'm very confident, and it's just a benign fatty lump.
What can I do for you today?
I've got a lump on my breast.
Right.
I've had it quite some time. I just
About how long
didn't
would
think,
you say?
oh, maybe a year or so.
Right.
Maybe a bit more. It's discoloured now.
Right.
I noticed it the other day. It was sort of.
So it
looks
seems to
like
be
it's
changing.
bruised, yeah. So I thought I'd better get it.
Yeah, definitely. And is it painful?
I wouldn't say painful, but I know it's there now.
Yeah.
Whereas I never used to feel anything.
Obviously, you'd be worried. You've put off coming. Why did you put off coming? Just.
I just thought it was, not like a cyst or I forgot what they call them.
Fatty lump or something like that.
I just thought that that's what it was.
Yeah.
And, I am aware that men can have breast issues as well.
Yeah, of course they can, yeah.
And so it's just when noticing there's a bit of bruise, I thought.
Right, I think we need to have a look at this.
Yeah.
Sit on here.
Yeah.
And you're happy for just me to examine it? You don't want me to get anybody else in or anything like that to sit with you?
Yeah.
Right, if you just come behind here, my love. I've just got to put a mask on when I actually get close up to you.
Yeah, do you want me to put mine on?
Well, you can if you want, yeah. Right, so you show me what you're looking at.
See ya.
There, yeah, I can see that.
You see, it's like bruised now.
You haven't bumped it or anything?
No.
You definitely not?
Definitely not.
Right, so I'm just going to have a look at your breast first. And then if you swing your legs up and sit back there. And I'm just going to have a feel.
Yeah.
Are you ready?
Yeah, no problem.
I thought you weren't from round here. That tattoo's just confirmed it. Hey, Warrington?
Yeah. I've been down here 18 years.
Do you know, I've seen so many people down here and hardly any of them are from down here.
I go up a lot, still got my family up there.
Yeah.
We go watching Warrington as well. That's been a suffer this season, so we've not been so much.
So this lump is smooth and it moves, but it is about maybe two centimetres or so.
Yeah.
Right. Sit back up. I'll help you with your T-shirt.
You sound like you're from the wrong side of the Pennines.
No, we don't want to fall out, you know. You can't beat West Yorkshire.
Whereabouts?
Bradford.
Bradford.
You been?
I've been-
Bradford, as people
Been
say.
to Oddsall a lot.
Yeah, you will have been, won't you, when it was
Yeah.
Bradford Northern and Bradford Bulls?
Yeah.
My dad were a massive Bradford Northern fan, it were then.
Yeah.
And unfortunately, my poor old dad didn't have any sons, so we had to go with him. You can come back here now, my love. I can take these. Right, so this lump feels smooth and it moves when I touch it, and they're really, really good signs. It is just in your breast tissue. I will make a referral for the breast clinic for that looking at, and I think you want it looking at anyway now, because it
never bothered me until it just changed colour. And I thought,
I'm not worried about the colour thing. I think probably what's happened there is it's grown a little bit. It might have just burst a blood vessel, or unknowingly you might have just bumped it. But I will make a referral to the breast clinic. All breast lumps are seen within 2 weeks, and that is because with any breast lump there always is a chance it could be a cancerous lump.
Yeah.
This doesn't feel like a cancerous lump.
Okay.
And you know, I think that this is probably going to end up to be a fatty lump, the way it feels and the way it moves, but we've got to do right by you.
Plenty of that.
We all. So I'll do that referral. People are seen within 2 weeks. Okay. Lovely to meet you.
All right, thank
Keep
you.
going
You
back
too.
up north.
All right. Oh yeah, we're up there this weekend.
Are you?
Yeah.
Oh, lovely.
All
Nice
right.
to meet you, sir.
And you, take care.
Cheerio.
Bye.
Bye-bye.
Okay, what do you do for work?
I work in a cafe, really busy one as well, so I'm on my feet for like 8 hours a day sometimes.
How long have you worked for them?
9 years nearly.
Okay, well, unfortunately, you know, these things are coming to a head,
Yeah.
and if you're missing one afternoon to see your diabetes specialist, is a lot better than missing 4 months because
Oh,
your
yeah,
feet are in
'cause I
such a
can't-
bad state. Which side's worse?
That's where it's so painful, all in there.
Okay.
So
I'm just gonna get
painful.
down. You just relax your feet up. Can you close your eyes for a second and just tell me if you feel anything?
Yeah. 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 Oh, yeah, all in there. It's really sore. It's only one side.
Just that's really sensitive, is
Yeah,
it?
really bad. But to tell me she thinks it's gangrene underneath is a bit scary.
Okay, I'm sorry you're in so much pain.
I just don't know what it is.
In terms of right now, I want to reassure you, I don't think you've got gangrene. I don't think you're going to lose a
Brilliant,
toe
that's
at
what
this
I've been
point.
worried about since Monday.
I do think you need to take better care of your feet. Take this as an opportunity to really just prioritise your diabetes care, because nothing's more important than that. And obviously, type 1 diabetes is a big condition to deal with for all those years. How are you coping with all that side of things?
I had really bad hypo yesterday. That's when I was at the hospital.
Okay, how often would you say you have them?
Well, at one point I was getting them every day, really bad ones. So they ordered me insulin, so I probably get one a month now, a couple of times a month.
That's still too much. You shouldn't be
too
having
many,
that. And you
yeah.
get awareness, you know when you're having there's blood sugars low.
You know quite quick, don't
All
you?
right. That's another reason to get your sugars in control ASAP, because you can start to lose that awareness and it becomes a bit more dangerous. Prevention is better than a cure, and getting your sugars under control has got to be the top priority.
Yeah, definitely. Yeah.
How many times have doctors given you a bit of a pep talk about it?
Quite a bit these last couple of years. I know I don't look after myself.
What can we do to try and help you kind of
don't know.
achieve it? Because this has only been going on for a very short period of time.
Yeah.
And we need to get all the diabetes stuff taken care of first. We
Yeah.
might, if it doesn't go away, it doesn't get better, there are medications we can give you. They take a while to kick in, but they're better at tackling pain from nerve damage. Look, I hope I put your mind at ease with this not your foot, it doesn't look
definitely.
gangrenous, but unfortunately, if your sugar levels don't get under control year on year, these horrible
get older,
complications we
yeah.
talk about won't become a possibility, they're going to
Yeah.
become a reality. I'll get you plugged back into the hospital team review.
Yeah.
We never want to have a go at you. We just, you know, when we're sort of saying this has gone wrong, this has gone wrong, we really want...
Sometimes mum does need it. Mum needs that
Yeah,
kick.
and I think that you need to talk to work, because
I've spoken to
if
him
they're
many
nice, if they're
times.
decent employees, just give them advance notice. I don't know how busy it is. I've got to take care of
Change my
myself.
shift. Okay, yeah,
All
that's
right.
lovely. All right then, yeah,
Okay.
that's lovely.
Any other questions before you go?
No, that's it now, thank you.
All right,
You
nice
put
to
my
meet you.
mind at ease about my feet, they're not going to drop off.
Well, yeah, I'll add the pain. At least the pain's getting a little bit better already.
Yeah.
But yeah, just take it easy. And
Yeah,
I would wear
I'll
something a
try.
bit more supportive than
I've
this.
always got my slippers on at home, so...
Okay, sure. All right, come on, do.
Thank you very much.
Cheers.
All right, thank you.
Perfect, thank you.
Thanks a lot.
See you later.
Hi, little guy. Say hi. Oh, he's very smiley.
Say hi. Are you ready to go in?
You guys had a nice morning.
Yeah, we've been shopping, haven't we?
Oh, lovely.
You've had a snooze.
Oh, that sounds bliss.
He's had his lunch, so he's all happy.
Pretty good life for you.
Yes, it is, isn't it?
Oh, he's gorgeous.
Thank you.
Aren't you? I think he knows it.
Yeah.
Now then, is this baby Jacob?
It is.
Come on, gorgeous. Do you know I've heard a right noisy boy out there?
Come on then, in we go. Oh.
And you come, take a seat,
Down
my
here.
love.
Thank you. Here we go.
So this is Jacob Morris.
It is, yeah.
That's you. Right,
hi.
lovely. Hello. Hello.
Ah.
Oh, you're a lovely boy, aren't you?
Good
yes,
boy.
you are.
You are.
Yeah. He's gorgeous. I've just looked in his record. He was born early, wasn't he?
He was, yeah, 8.5 weeks early he was born.
Wow. What
Bit of a shock. But all good.
Yeah, and he's done well ever since.
Yeah,
He looks
yeah.
great developmentally. You wouldn't
Yeah.
really know to look at him, would you? He's a
doing
big
really
boy.
well. Yeah.
Yeah, so what are you worried about with him today?
So yesterday we noticed, or I noticed, his ear, the top of
Right.
his left ear, it's sort of got like a little white lump.
Yeah.
It doesn't look sore, but then...
Oh, you can see that then.
Yeah, and then it's got like a little black dot. I don't know if the black dot is something inside the ear.
I'm just going to get my little light and have a look.
Sit still. Good boy. Good boy, Jacob. You're nosy, aren't you?
Yeah, it looks like a little spot, doesn't it?
It looks like there's something in there, doesn't it? Sit still, sweetheart. Good boy. You're doing so well. Good boy.
Right.
Okay.
And I can tell he's the picture of health to look at.
He is,
It don't
yeah.
look infected, it don't look like a bruise, it looks like he's got a tiny little, a funny little spot. Or
Yeah.
and I don't think it's anything to worry about. Just keep your eye on it.
Yeah.
I wouldn't want to mess with it really, because I
Okay.
think it'll settle down on its own.
You think it will just go by itself?
Could be a spot, or it could be the start of a tiny little hemangioma, which is like a little collection of blood cells.
Okay.
But they settle down as well.
Okay.
If it just stays like that and doesn't change at all, that's fine.
Yeah.
If it gets bigger,
Okay.
then book and get somebody else to have a look at it, or if
Okay.
he gets any trouble.
Yeah.
You're a right wriggler, aren't you? Eh?
You don't keep
You're
still.
a right wriggler.
Do you?
Yeah. Oh, I bet it's just a joy, isn't it?
You are, aren't you?
You wouldn't know that he were born early. He's a right adventurous little chap. He's
you?
desperate to get on this floor, isn't he, and
He
get
is.
up to mischief.
Yeah. Pull himself up. Touch things. Aren't you?
Yeah. He says, oh no, I just want to throw myself back now.
Say thank you.
Bye-bye.
Say bye-bye.
Bye-bye.
Say thank you.
Bye-bye. Bye-bye. Yeah. Oh, I wish I could keep you in a little box under my desk today.
Come on then. Okay, that's
It's
lovely.
lovely to meet you.
Yeah, thank you very much.
Don't worry about it and just
Okay.
keep your eye.
Yeah, that's
Okay,
lovely.
gorgeous baby.
Thank you.
Absolutely lovely.
Bye-bye.
Cheerio.
Thank you.
See ya. Bye-bye.
Let's go. Are you ready? Oh, say bye. Thank you.
So lovely to see you.
Thank
Have
you.
a good day. Bye.
Come on then.
Hello, Mr. Aparidarko. Hi, I'm
Oh,
Dr.
Prof.
Khan.
No, you are Prof.
Well, Professor Khan, yes, how are you doing?
I'm fine, thank you.
Good. Are you ready for me to see you?
Yes,
Is
please.
that all right? Let's take these off.
You can run, but you can hide.
Right, let's just see if we can get in here.
Look
How
at
is
that.
Come and sit over here.
Ooh. Spin you around. Is that okay?
Yeah, it's fine.
Excellent. Thank you very much.
Thank you so much.
Well, tell me how you're doing and how I can help today.
I had this stroke 2017.
Yeah.
And I had the operation, took scalp on here.
Yes.
But it's not working.
Okay.
There's a lot of pain in my head.
Looking at your notes, I know you had this stroke and they took a clot out, didn't they?
Yeah.
Yeah. And then, how long have you had this pain in your head for?
Since the operation.
Since they've done the operation?
Yeah, the surgery, yeah.
Okay. What does that pain feel like to you?
Oh, it's unbearable, Prof.
Yeah.
We've met before, haven't we?
We have indeed.
Oh.
We have this relationship.
That's dirty.
Well, you're gorgeous, aren't you? I can't stop looking at your eyes.
I love your hair, by the way.
Thank you, I had it done yesterday.
It's gorgeous. You're on the beach. Take a nice deep breath for me.
That'd be nice.
Go to a nice happy place.
Good. But you keep doing what you're doing because I think you look absolutely fantastic.
Thank you very much.
Thank you so much.
Oh.
Wow.
Yeah.
Come here.
No, I mean, the service I've had has been, you know, second to none.
Sometimes it's like tingling, painful tingling goes through my head.
Yeah.
So a sharp one, and then there'll be a fire in here as well.
Oh no.
Goes
Okay. Is it there all the time?
It's there all the time.
Does it keep you awake at night?
I don't sleep at night. It's like I got brain freeze.
Okay.
My whole head becomes like fist.
Oh gosh, okay. I mean, this stroke sounds very dramatic and it's changed your life, I imagine.
Entirely.
Yeah, tell me about that.
I was a strong guy. I used to work. And now I'm housebound. He's in a wheelchair and carers come and assist.
Really hard. Who do you live at home with?
On my own.
You're on your own. And how's your mood?
Sometimes it's all right, sometimes it's a bit rough.
Who do you support football?
Man United.
Man United? Behave yourself. I'm a Liverpool fan.
Oh.
I think, because you've had a CT scan a few months ago, I'm not worried about any swelling inside of the head. I think this is nerve damage from when you had the original operation. The burning, the kind of the brain freeze symptoms that you're getting in there. We'll give you some targeted medication which helps with nerve pain. And one that I've found that has been useful in some of my patients before is one called duloxetine. One of the side effects of duloxetine, which I think might be useful, it can actually help lift your mood a little bit as well.
I'll take anything that will
help. Yeah. Who does all your cooking for you?
Well, my daughter makes the main cooking and I put it in the freezer.
Okay. Is she a good cook?
Yeah, I was, so I trained her.
You were a good cook?
Yes.
Yeah? What kind of things did you cook?
I do peanut butter soup, it's my favorite.
Peanut butter soup?
Yeah.
I've never even heard of that.
Oh, it's very nice. With rice, you will love it.
With rice. Oh, listen, so nice. And I'll send that medication across to the chemist.
Yes, please, thank you.
Right, you're going to be testing my driving skills.
I'm not expecting you to be a jack of all trades.
I'm definitely not.
Just had a little look at your record. You've had a stormy time.
I was going to say, yeah.
Do you want to tell me all about it and what's brought you today?
So 3.5 months ago, they found a cancerous lump in my pancreas. Long story short, it stemmed from having bruising on my legs to then discovered that it was a neuroendocrine tumour. Which I got removed, but it was like a 10-hour surgery with a lovely war wound to go with that.
Well, it's healed up nicely, but...
Well, yeah, no.
What a shock for you.
It was awful. Yeah.
Had you been well?
No, I've been fine. Absolutely nothing wrong with me, working full-time, 3 children, 2 salons, a dog. So yeah, no, completely fine. Very busy.
And how did you go from having some bruising on your legs to...
I was literally in bed, sent my sister a picture. It's like, God, because she works in pharmacy. I said, I've got a lot of bruises on my legs. She said, oh, send an e-consult. So that's what I did. Had an ultrasound done, and the lady was there a while, and I kind of thought, oh, it's okay. Yeah. And then she said, oh, someone will be in contact. 2 hours later, had a phone call to say they'd found some, and it would turn out to be a neuroendocrine tumour. And they reckon it could be grown for 10 years.
Grown really, really slowly. I've looked at you like they think that...
They think that's it, yeah, now. Hopefully, yeah, as obviously as sure as anybody could be.
Yeah.
So I'm on Creon now, 7 tablets every time that I eat. Yeah. But the issue I've got now is I feel continuously sick.
and they think what's happened is the sutures have not dissolved, so they're not sure whether there's an infection that's kind of reoccurring, because it kind of calms down, then it flares up again, and I have to keep checking my blood sugar levels, because obviously most of my pancreas is gone, and my pancreas that's left goes into my stomach, so it's kind of all upside down. So yeah, I don't really know what to do.
I mean, I've just seen your suture line. It's not.
It looks
red,
lovely.
It's not,
No,
it looks absolutely
it's not angry.
beautiful. Tara's very positive, and she knows her digestive tract has really changed following this major surgery that she's had. Her eating habits will always be different. She will never be able to be impulsive and go places without her medication. But it's a case of her balancing what she does, what she eats, and what medication she needs. Over time and trial and error, she'll be able to make small changes to her life and do what's best for her.
And that's
what you've got is a very, very rare
I'm really
condition.
lucky.
You are very lucky.
It could have been worse.
But it could have been much, much worse.
So yeah, it's not ideal, obviously.
But
I'm
but
here.
it is, yes, exactly.
Yeah.
I'm just going to go and have a word with Dr. Amir, who I'm working with today, just to see what anti-sickness he would think. Because it's not.
It's bizarre, like I say. It's not. It's quite a complex kind of.
It's very complex when you've had a
thing.
big operation like that. So I won't want to give you anything that could potentially make it worse.
Please don't do that.
You know, we definitely don't want to do that.
Yeah.
I'll be back in a second.
Yeah, that's fine, darling.
Okay, thank you.
Come in.
Amir, can I just ask you about this patient? Yeah. So I've got this lovely lady, and she's only in her 30s, and 3 months ago she was diagnosed with a neuroendocrine tumour, but she's cured.
Yeah.
But she's having a lot of problems. She's on omeprazole, she's on Creon, she's got a lot of sickness, feeling sick, and she's tried cyclazine, and that's not made any difference. Would you suggest we try something else? What do you think we should give her?
I'd go on Dansatron.
On Dansatron?
Yeah, 4 milligrams. She can take up to 8 milligrams.
4
But I'd start with
milligrams.
4.
And how many times a day do they have it?
Twice a day. But that usually, particularly post-cancer on Dansatron, works better than cyclazine.
Right, I've just had a word with him.
Yeah.
We'll try you on one called Ondansetron,
Okay.
which is a really good anti-sickness, and it's very well tolerated.
Okay.
4 milligrams is the dose we start with twice a day.
Okay.
But it can be increased, so you can contact in a week or two if things don't change.
Yeah.
Is that
darling.
okay?
Yeah, it's perfect. Yeah, thank you.
Right, well, it's really nice to meet you, and
thank you, my darling.
what a story.
I know, what a story.
What a
I'm still here to tell the tale, though.
You
so
are, you're still
that's
looking
it.
fantastic.
Thank you, my darling. You're
All
a
the
star.
best, my love.
Thank
See you later.
Thank
Bye.
you. Thank you, darling.
Thank you so much.
See you soon.
Bye.
Bye.
Right.
All right, have a good rest of your day.
Bye-bye.
Bye.
Thank you very much.
Perfect.
Right, lovely to meet you.
Yeah,
Thank
nice
you.
to meet you. Thank
Cheerio.
you. Cheers.
Thank you.
Super. Well, good luck with the training, and
Thank you.
that's very exciting. Take
Thank
care.
you so much.
Bye.
Bye.
Nice to see you. Take care.
Thanks ever so much.
Cheers, yeah.
Thanks, Doctor.
Take care. Bye-bye.
Bye.
I think in health it's so important that we all remember how privileged we are. People tell us things they would never tell anybody else, and the trust that patients have in us is amazing. I feel proud and humbled every day to be an AMP.
As I'm touching you, can you feel me touch?
I don't like it.
You don't like it?
I don't like. No, not nice feeling.
And are you sexually active?
I think so.
Yeah? You think so? You know so?
I'm just concerned that maybe the lining of your brain is a bit inflamed. So I think we need to send you to A&E.
And that's New GPs Behind Closed Doors continuing next Tuesday at 7. Dr. Amir Khan is back here tomorrow night at 7 when he helps a busy mum and a business owner sort out their diets in You Are What You Eat. Next tonight, an over-affectionate Labradoodle is making one family's lives a misery, and a cockapoo who makes a dad's life hell in Dogs Behaving Very Badly. The new series starts after the break.